This is an example of an oral appliance. As you can see, there is two denture-like devices, a lower denture and an upper denture. On the lower denture is this little wing-like device, and on the upper denture is this screw-like device. This works by advancing the screws against the wing, causing the lower denture to move forward, and thus bringing the tongue away from the back wall of the throat, relieving the upper airway obstruction. Oral appliances are approximately 60 to 80% effective at reducing or eliminating snoring, and they are about 50% effective at reducing the obstructive sleep apnea syndrome. They are best used in patients with mild to moderate sleep apnea or in patients with severe obstructive sleep apnea syndrome who refuse to use nasal CPAP or are intolerant to nasal CPAP. I'm Dr. Ronald Popper, Medical Director of the Southern California Pulmonary and Sleep Disorders Medical Center in Thousand Oaks, California. To view more videos to help address all of your questions about sleep apnea and other sleep disorders, please view our website at sleepmd4u.com. Thank you for watching, and always remember, sleep well tonight for a better day tomorrow.